Hello, everyone, and welcome to episode 3 of the Neuromatch Road to Residency YouTube series. My name is Mariam Abdul Wahid, and I am final year medical student at Down Medical College, as well as a member of Student Interest Group Neurology. In today's discussion, we'll be exploring the next big steps after completing a neurology residency. So, without further delay, let me introduce our speakers for today's session. Joining us today is Dr. Saud Khan, the Stroke Director and Rehab Director at Titus Regional Medical Center in Mount Pleasant, Texas. With 19 years of experience, Dr. Saud works closely with UDSW and is a part of Gurner's Stroke Group. He is a graduate of Down Medical College 1996, and he is a board certified in multiple specialties, including neurology, vascular neurology, neuroimaging, brain injury, medicine, clinical neurophysiology, and neurocritical care. Along with him, we have Dr. Fazeel Siddiqui, an interventional and vascular neurologist with 11 years of experience in vascular neurology and 8 years in interventional neurology. Dr. Fazeel is currently affiliated with the University of Michigan and Michigan Southwest Hospital. He graduated from Down Medical College in 2004, and his research focuses on interventional treatments. We are really grateful to have you both today for this episode. So for today's episode, we'll be focusing on the life after residency. And I think the transition from residency to practice is definitely an important moment in any neurologist's career. And after years of rigorous training, this phase brings both excitement and many questions about the future. What comes next after completing residency? Like, is there a clear path to follow, or it's like just the options feel very overwhelming? So today we'll unpack those immediate steps. So let's start with our questions. Dr. Saud, if you'd like to tell us, what are the immediate options after completing neurology residency, and how did you decide on your next steps after completing your residency?
Well, this is a very open-ended question. So I think the first question should be, why did we choose neurology than any other medicine? And that question came when I was doing my student rotation, especially different rotation when you are going through. You want to know what is the field which you want to live with, which you have a passion for. And during that rotation in civil hospital, Dr. Akhtar Ahmed Khan Sahab, he did a very good lectures of neurology, how to localize the lesion. And it was very close to 1994, 1995 when the TPA was coming and getting approval. And it was fascinating lecture at that time. So at that time, you see the whole passion for neurology, whole interest in neurology started because of clinical history, because of localization, and because of being fancy that ultimately history can give us a good diagnosis, localization and diagnosis. So once that experience was there, then we went through the neurology residency. Um, and again, you went through different rotation. You did your EEG, you did your critical care, you did movement disorder, EEG and EMG. And then during that time, ultimately after the neurology, what you want to do. Coming from Pakistan, I think we have a passion for vascular neurology or stroke care. We want to do something new, something for the patient, which can be done properly at that time. So during that, always wanted to do vascular neurology at that time. We are talking about 2005 graduation from Oklahoma University. So when I went to one of my mentor, he told me, no matter what you want to do, EEG and EMG is a bread and butter for any neurologist. So even if you want to do anything like vascular neurology, stroke fellowship at that time, go for at least EEG and EMG. With in some from different neurologists' perspective is that EEG, EMG should be part of actually residency. So anyhow, so I did my clinical neurophysiology, EEG, EMG after my residency. And then after that, again, there was an insect of vascular neurology was already there. And we are talking about 2005, where stroke care is not there yet. Where intervention was not there yet. So ultimately, I went for neuroimaging fellowship in Buffalo, New York, Dent Neurological, read 16,000 MRI in that fellowship. And I really felt comfortable about vascular neurology plus stroke care. And after that, so once that the fellowship, EEG, EMG, and neuroimaging was finished, I joined as a in academic center at KU, Kansas University Medical Center, just to brush up your skill sets, for 3 to 4 years. And again, it's all about your mentors. It's all about who you are training with and how you are brushing up your skill set. So during that 3 to 4 years, the biostats, I mean, they were very much into research, and the whole database I collected during that era too. So again, fellowships were done in order to for your whatever your interest was. Vascular neurology, I wanted to do it, but then at that time again, there was no fellowship, so I was a grandfather in that time period. So I took my vascular neurology exam. So I was a grandfather in, and then clinical neurophysiology fellowship was done. I got board certified, and in during that same era, there was neurocritical care. Again, fellowship was not there. I was grandfather in. I just sat in the exam and cleared it. And brain injury medicine. So same scenario continued, and then ultimately I went for the practice in one of the county hospital in Dallas, JPS. Again, I spent 3 to 4 years, felt comfortable, and then an opportunity raised where they wanted to create primary stroke center in Mount Pleasant. So I joined in that town, Mount Pleasant. It's around 10 to 15,000 population. We built in level 3 stroke center. Then from there we went to primary stroke center. During this time, I was also working at JPS and built up the comprehensive stroke center in 2016. So it was a sequence of the events. Most likely, it was your passion, what you always want to do. That at the middle of night, when the telephone call comes in, you feel that you will want to help the patient. So it was a sequence of the events, your passion. Ultimately, it will take you to some goal there. So that's how my journey was.
Thank you so much, Dr. Saud, for sharing your whole experience. And I guess it's a really, really long journey and definitely different for every individual. So,
I'm sorry.
yeah, I know it's. I think we do learn a lot from hearing someone else's experience. So, thank you so much for sharing it. So, like building on to that, further in after completing residency, and also after hearing the whole journey of Dr. Saud, another question that comes into mind is that after one completes residency in neurology, is it really necessary to do fellowship as well?
So
Uh, it is a question for Fazil or
No, no.
to me?
If you want to go on, you can take it as
go
well.
ahead.
I would say that as a neurologist, we need to have a good sense of EEG, DMG. So that should be part of our residency, to be frank. And then ultimately, vascular neurology stroke fellowship, and it's all about what your passion is. So yes, fellowship is needed. It really helps you. Your mentor helps you. Your confidence level goes up. Your skill set goes up. So whatever you want to do, it ultimately fellowship really helps you. Yes.
Great. So, Dr. Siddiqui, if you'd like to go on and add in this
Um,
conversation, yeah,
so I think your question is after residency, what should we do and how do we decide, right?
yeah, exactly.
Yeah.
And if you'd
So
like to share your experience,
as Dr. Khan mentioned that there's multiple factors that go into that decision making, including your passion before the residency. So I was always interested in vascular neurology because before starting my residency, I worked in Aachen University under Dr. Aisha Kamal back in 2005. So that helped. That gave me a lot of interest in vascular neurology, and intervention neurology was also kind of becoming very popular. So I heard about it So when even before I started my residency, I was into going into vascular and intervention, but it's different for everybody. Like it also depends on your immigration status. You have green card or you're in a visa. uh, are you married or you're single? What are your other responsibility? uh, are you more passionate about academics? You want to publish, research, teach students versus you want to have a lifestyle. You want to retire early. You want to raise your kids. So everybody has a different type of thinking about life. So everybody is different. So and that kind of comes into play when you decide about what to do after your residency, because once you have done your general neurology, you have options to stop right there and get a job. Now, if you're on a visa like us, if I was on a J1 visa, my options are very limited. So, if I'm just general neurology, I probably have to go to a rural area and do 3 years of J1 waiver, or come back to Pakistan and do 2 year requirement in my home country. So that's why one of the factor that if you're on a J1 visa, we decide to, okay, maybe I should do another fellowship that kind of makes me more marketable for better jobs in bigger cities. So that's comes into play when you start doing vascular neurology or epilepsy fellowships. Now you have to look at the job market around that time too. So when I finished my residency, that was 2011. Vascular neurologists were in shortage. So there was a lot of jobs for the vascular neurology and neurocritical care. But every year, every 5-10 years, that switches and something else becomes popular. Nowadays there's a shortage of movement disorder physicians. Back then there was more vascular neurologists. So you have to look at the job market too, what you want to do. And then lifestyle. So if you want to do academics, then you have to follow your passion, what you want to do. I always wanted interested in stroke treatment, interventional treatment, so that was always my research focus, teaching focus. So that's why I chose that path. Now some people are more interested in movement disorder, which was my second choice, but I was more interested in stroke. But some people are very into movement disorder, MS, so they choose that route. And those are the things you learn more when you do your residency, right? So in the first 2 or 3 years, you have exposure to everything. You have exposure to outpatient, you have exposure to inpatient, and that kind of helps you out deciding what to pursue. Now, lifestyle. So people like us, Dr. Khan and I, we like to take call. So we get woken up multiple times at night. We suffer through it. Some people don't like that kind of lifestyle. They want to do a 9 to 5 job. They want weekends off. So for them, outpatient is much better than inpatient. Now, I don't like treating headaches and I don't like doing the outpatient stuff. So I chose the inpatient side. I feel like that's more, I like to see acute stuff. So, everybody is different. And that's why we make those decisions.
Right. There were some great points indeed. So, before we move on to the next session, now that we have an overview of some of the subspecialties, Dr. Saud, if you can list down some of the common subspecialties in neurology, so that our viewers know like what are the common options, what
Sure.
are the ways, please? Yeah. Sure.
Sure. As I said, as a neurologist during residency, you are exposed with different rotation. As Dr. Fazeel pointed out, movement disorders. Sometime epilepsy unit is there. We were running very good epilepsy unit during residency. Actually, we were having weekly conferences and localizing the lesion, doing the SPAC scan, and then doing the temporal lobectomy. So again, different exposures are there. So fellowships usually nowadays, first one comes to the mind is vascular neurology. Then it can lead to intervention, neurointervention. How far you wanna go? The other fellowship comes sometime the neuroimaging fellowship is also coming. American Society of Neuroimaging is an organization for the last 20, 30 years. And we have actually coming conference in Dallas this January, actually. So neuroimaging fellowship is there, movement disorder fellowship is there, clinical neurophysiology, which is a combination of EEG and EMG. Sometimes epilepsy is a part of it, a different fellowship people do. Epilepsy is also different, localizing the lesion, localizing the focus, where is the seizures coming from, then going for the high-tech temporal lobectomy or laser surgery. Movement disorder and headache fellowship is also coming into the picture. MS sub fellowship is also coming. So there are different options are there. I mean, it depends what your interest is.
Yeah,
Thank you for the yeah, Dr.
I
Fazeel.
would add on to it that as Dr. Khan said, that it all depends on what your exposure initial first 2 years during residency, and then that kind of makes up your mind. Whether you want to do inpatient and deal with like the acute stuff versus outpatient. So that's the first thing. And then once you decide, okay, you want to stick with outpatient, then you look into the fellowships, like epilepsy, multiple sclerosis, which has become broadening to now neuroimmunology, because there's way more stuff than just multiple sclerosis. Then we have uh, neuroimaging is one. Then you could go into peace neuro, which used to be easy back then with adult neurology. You could just do 1 or 2 years of peace neuro. Nowadays you have to do a residency in peds. uh, then there are some rare fellowships, like uh, where there are jobs, but there are very few jobs. Like neuro-oncology is one. Though usually those jobs are only in big academic centers. So if you are very much interested into that, you could go into those jobs. Neuro-ophthalmology is another rare fellowship people do. Uh, you could do 1 2 years of neuro-ophthalmology, and then you can just see the eye disorders, neuro eye disorders. So uh, yeah, so first step would be deciding inpatient versus outpatient, and then second step would be, okay, which outpatient.
Thank you,
I will
Dr.
say,
Fazeel.
I will say
Yeah,
go for, yeah, inpatient outpatient division is good, but also go for your passion too, which you
Yeah.
really has an interest in. I mean, no matter what we do, we will go back to our passion.
yeah, yeah, exactly. Great. Thank you so much for breaking that down, Dr. Saud and Dr. Fazeel. So, Dr. Fazeel, as you have already mentioned regarding how some people also um, like focus on the work-life balance when choosing their field. So, balancing a demanding medical career with the personal life is always a challenge in healthcare field, and obviously neurology is no exception. So, what does the work-life balance look like for neurologists? So, if Dr. Fazil, if you'd like to tell us, what does a typical day look like for you in your current practice?
So I chose inpatient, so I take a lot of calls. So that usually means that I don't have any dedicated work hours. So I do neuro intervention. So I get we only have two people that who do neuro intervention in my hospital. So we take 2 weeks in a month on call 24/7. So that means I work during day hours for my regular stuff, routine procedures, diagnostic, which I was doing it today. And then I can get called in when there's a stroke, thrombectomy needed in the middle of night. So I have to come in for aneurysm treatments, all those emergencies that we deal with. And I like doing it, so I don't mind doing it, waking up for that. But yes, that's the lifestyle. So usually I take 2 weekends in a month. I'm on call, so I have to come in on the weekends, Saturday, Sunday. It depends on whatever time the stroke comes in. I have to come in and do those procedures. So and then I can find time. So I'm so used to it now that I can find time to do the other stuff during that. So we still go out and eat if you want to, and then if I get called, uh, I just go back and then drive my car back to the hospital. So my wife is also knows, so that's how it works. So we understand each other, so it's not a big deal. But for some people, it could be a big deal, right? So I mean, you want to have a nice time, and your spouse gets called in. That's a big deal for some people. So you have to make those decisions uh, as you decide on your life and how you want to proceed. When kids come into play, I don't have any kids, but for some people, when they have kids, that becomes a priority. So taking calls like this could be an issue for them. So this kind of lifestyle doesn't work out for them.
Very interesting. Okay, thank you for sharing your daily life with us. And Dr. Saud, if you'd like to tell us about your experience, and with your 19 years of experience, how has it been for you to manage work-life balance in such a demanding field?
So that's why I didn't pursue neurointervention, because I knew the lifestyle will be, well, 2 hours, 4 hours sleep at night, ADHD, because devoid of sleep. But again, if you have a passion, go for it. And I did have a passion, and still have a passion, but sometimes you have to just adjust to it. So my lifestyle is a little bit different. I work 4 days and 3 days off. But those 4 days, I'm taking the whole calls, 24 hours, taking care of TNK cases, stroke patients. During the daytime, I'm running a clinic. I have one nurse practitioner, five MAs. We are seeing 4 days clinic, new patients, follow-up cases, reading EEGs, doing EMGs. And during this time, if I get the telephone calls or a stroke page from the ER, from the floor, I have to take care of it. But then from Thursday noon to Monday noon, I'm off. So that's why I'm talking to you right now. I follow the whole Friday rituals, I try to follow the namaz regularly. And then family time is there too for Friday, Saturday, Sunday. So quality of time is there for 3 days. And then rest of those 4 days are busy, I must say that. But still, I'm able to hit those. I think there was a one book came, 4 day weekend work. And it has shown that even in government offices, when they work for 4 days and 3 days off, they're more productive than working for 5 days and 2 days off. It saved the gas prices, and it also had the quality of life for the people. So that was the main reason I did not go for neurointervention. At some point, I said, "Oh my goodness!" And there was shortage. There was no one, but he was doing the neurointervention in 2005 or six, and I did have a fellowship offer at that time. But again, things were coming. So, but again, go for back to your passion. Trust me. Um, if I get a phone call at 2 a.m. and I think that patient will be a very good candidate for TNK, and when Alhamdulillah it is successful, that's feeling you cannot avoid it. There is a recharge of your battery. I mean, again, Fazil can point out when he will go from back to me and the clot is done and patient has gone back to previous normal state. Then that's a feeling, fulfilling feeling for your career, and that take away all the tiredness.
Yeah, I totally agree. Like, you get that, I don't know, a rush, adrenaline rush before the procedure and after when the patient gets better. Like, it's an amazing feeling, which I cannot describe, like, how amazing that is. So that's one of the thing that you get from this, along with other things that you don't want to. So, there's then these things you will understand when you do the residency in second, third year. You would know what kind of lifestyle you want to choose. And neurocritical care is another field we didn't talk about. So that's basically you're doing a neuro ICU. It's a full-fledged ICU, but you only see neuro patients. And that you can also go through neurology residency. Some medicine doctors can do it too, but mostly from neurology. Uh, That is very similar, but that's more like a shift work. So you do 7 a.m. to 7 p.m., or sometimes you do take the night shift. You stay in the hospital. Sometimes you can come in and go from home, and that's very critical. You do intubations. You manage the ventilator. You do everything like an ICU doctor, but you're managing more patients. So that is also a good field if you like acute inpatient, but you don't want to take like a 24/7 call like me. So that's another, you can get your passion for acute stuff, but you don't have to have a lifestyle like neurointervention.
Okay, so now that we have discussed how one's passions play a role in joining, in selecting subspecialty, and also how work-life balance plays a role, another question that comes in one's mind, and I think many of our viewers will be looking forward to it as well, is that how is the financial situation for this field? So obviously, along with passion, financial stability is also a factor when choosing any career path. So what kind of income can a neurologist expect? And if you guys would like to share anything related to this, Dr. Saud, if you like to go on.
So yeah, I mean, you can look into the financial aspect, but I must say, whatever you do, if you do it properly, if your skill set is good, you're well trained, and you are feel comfortable, whatever you want to do, it will bring back good compensation. So that should not be an issue. But overall, when you are freshly graduate, so you have to be aware of the market first of all. There are different part of the states have different tiers parts how much they pay. The West Midwest usually pay higher. California pay less. New York City, the Northeast part. So you have to do some type of screening. I must say that first of all, you want to know which weather you want to live in, or which town you want to live in, which state you want to live in, and then little bit difference of compensation is there. But if you are doing the procedures, it will be bringing up enough compensation for the hospital, for your clinic. It has cut down, there is no doubt about it. In last 20 years, Medicare, CMS has cut down the EEGs, EMG compensation, but still, it's not so bad. Overall, nowadays, the trend is when you graduate, you try to join as an employee. Employee salary usually start from 350 to 400 something, so do not negotiate less than that. You should be aware of your market, and then go from there, but that should not be the upper limit. You can start with this. So it is for a general neurologist, neurohospitalist, 350 plus in most of the states. But again, some states pay less, some states pay more. But it's simple concept is supply and demand. Supply and demand. Okay. So vascular neurology shortage was there, even still there. Vascular neurology, neurointervention, they are the god now, right now. So they are in full demand. So they can dictate whatever they want. Hopefully, Fazil should be in a happy mood nowadays. But still, I must say that compensation will not be an issue. Whatever you want to do, you want to do some research. What state is paying? There is a website of MGMA. Sometime you can get some information about that current year, and then try to negotiate. But there is starting, you should know, and there is should not be any upper limit. Let's put this way.
Yeah, I agree with Dr. Khan. So one thing my chairman used to say that, follow your passion and money comes with it.
Yes.
So, that's the motto. It just, money will come, so it's not an issue. So, but yeah, again, if you are doing something you don't want to do, no matter how much money you're going to get, you will not be happy in your life. So, so you have to follow your passion, and you will be satisfied. Regardless, we are doctors. We make enough money regard whatever we do. So it should not be an issue. Now, I always advise the medical students, when you're looking for residency or fellowship, never ever ask the question about money when you're interviewing for residency or fellowship. That can take off your fellowship director and or residency director, and and you're probably not going to get matched.
But I must say, yes, this rule apply for residency and fellowship. But once you have graduated residency or fellowship and you are going for the private practice, yes, you can behave. Yes, you can see the whole picture when you are interviewing. But after that, negotiation takes time, but you should not shy off. I mean, you should put down some numbers, but the negotiation also tells us, if you look at the books of the negotiation, do not give any specific numbers. You know, us keep it open ended and see how much they can offer.
Right. So, building on the conversation, and the next question was actually what Dr. Fazil did mention, that if an IMG specifically has to consider one thing, that is between one thing between passion and better financial stability. So, what will it be? What will be your advice? So, I think Dr. Fazil's answer is that go after your passion. So, Dr. Saud, what would you suggest? What would be your advice?
Same thing, passion, 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 and money, money will follow you. There's no limit. But passion, if you're not happy, you know you cannot sustain.
Yeah, and then I would add on to the IMG part. So you're on a visa, so doing fellowships, make you more marketable. You can get a better job. You can get a better job in big cities like Dallas if you have, or New York or bigger cities if you have more fellowships. So that does help.
So I think we have covered the basic segments that we had decided for this episode. But apart from this, if there is anything that you guys would like to add,
Yeah, so I can speak few words, like, again, the journey, as Dr. Khan described, journey can be very long, but you eventually see the fruits of what you do. So you should always keep working hard, and you're going to have a lot of failures in life. So you're going to have visa rejections. If you're on a visa, you will not get the job or fellowship you want to get, because of visa. Visa is a big deal for us. So, and I always say, you have to make sure that you take care of it, because sometimes we are so passionate about doing what we want to do, we forget that we are bound by this J1 visa. So we keep doing things, and we kind of keep prolonging. Uh, Stability from immigration, stability from financial, we are always going to be stable, but stability from immigration point of view is very important. So because you will get stuck, people are going to abuse you, because if you're on a visa, uh, your job people will know that you're on a visa. They're going to pay lowball you, they're going to pay you less, they're going to make you work hard. So that's why you have to take care of the visa. You always, this is the most important thing, coming to America. Uh,
Hmm.
thank you
Very
so
well
much,
said.
Dr.
You're very well said. I must say, I mean, I think the take home message will be for the students in neurology. Um, Ba the banasib, be the benasib. Always respect your teachers. Okay, that starts from there. That's our strength of our culture. That's our strength at home. So we should just be proud of that. Okay. Then hardworking. Wake up at specific time. Tiny lectures are very important. And nowadays, AN podcast is there. Every week, you get fresh information. So you have ingrained in your habit schedule that we have to read advanced neurology plus basic neurology, and you have to connect the dots. Okay. And then go for your passion. Go for your passion. What you want to do, what you like it, that the money will follow. There is no doubt about it. And as Fazil said, the immigration issues are there. So you have to have a good pathway. And once you are done, then you can negotiate better. Unfortunately, there is some politics, and it happens everywhere, whether it is in Pakistan. And we all know how it works in Pakistan anyway. So you don't want me to talk about in next 5 hours. But anyhow, so in US again there is a politics. In private practice there is politics, and you have to see what are your possible opportunities are there. You have to be diplomatic. You have to be politically correct, and then you have to do the best in a given situation. And Allah has told us. I mean, if there is a failure, there is a good pathway for the future. Simple as that. So just stick to your passion, stick to your what you want to do, but be realistic and practical too. So, okay.
Thank you so much, Dr. Saud Khan and Dr. Fazeel Siddiqui, for your time and for sharing your expertise and experiences with us today. And your insights have truly been invaluable. And for all our viewers, thanks for tuning in. If you enjoyed this episode, please subscribe and share it with your friends on the neurology path. And let us know if there's anything you'd like to discuss in upcoming episodes. Your feedback keeps us going strong and helps us bring to even better content. Thank you
What
so much for joining on.
what is the
And
address? What is the address of podcast? How
okay,
to?
we'll be posting this on YouTube as episode 3. We haven't we'll be posting episode 1 tomorrow. So this episode will likely be posted in the coming week, definitely.
Okay.
Thank you.
Thank you.
Thank you
Thank you.
so much for your time. And
Thank
I'm
you very
really sorry for my internet issue.
No, that's
much.
fine. We understand.
Yeah.
And
Thank
it
you.
was a short episode, but I really enjoyed it, and your insights were really helpful.
You're welcome.
Yeah.
Thank you.
Take care.
Love it.
Allah Hafiz.